we have time for, Veronica had given me the mandate to get everyone back on time, so we might take a few minutes depending on the questions. So while people are moving up here, questions from the audience? Yes.
Hello, I'm Renzi Viva from the School of Public Health Law student, also from the Philippines. My question is actually to Ramesh, but it basically was inspired by Amalia's presentation. You touched upon the challenges when it comes to harmonization in a region, and in Southeast Asia, and I'm sure Ramesh is probably monitoring it, ASEAN integration, which has started in 2015, has been happening, and even a decade before that, there are already efforts towards harmonization of pharmaceutical regulatory standards among 10 countries of Southeast Asia. So I'm just wondering, what are some lessons that maybe Latin America can learn from ASEAN as it pursues greater cooperation and harmonization when it comes to pharmaceuticals?
We'll take a couple of questions.
Hi, my name is Ken Shatlin. I'm from London School of Economics. I have a question for Veronica. Just quickly, I was just wondering if you mentioned in your talk, just follow up a bit more about what are some of the political obstacles to putting in regulations that require prescription by generic name, making it not just an okay thing to do or not do, but actually make it mandatory.
Any other questions right now? I'll just jump in and ask a question of this really extraordinary panel. I had a quick question for you, Veronica, because when you were talking about the difference between generics and similares, and in Mexico how that has shifted, it reminded me of the very popular farmacias similares and Dr. Simil, and how much that has become a part of the national imagination of when we think of generics. So how is the public understanding this shift from similares to generics? Because I think there seems to be a disconnect between the user, the patient, of these pharmaceuticals, how they are called within Mexico. And Ramesh and Analia, I have a similar question about something that we saw in one of your very interesting sites, Ramesh, when you commented Venezuela has gone down, not surprisingly because of the political situation in Venezuela, which I think this is a co-question for both of you. And first, Analia, with who are you dealing with in terms of the government? Because you said the majority of it is in the public sector. When we see this with the situation of Venezuela, but there's increasing instability with certain governments and new elections. I'm thinking here of Mexico's election coming up in July. In terms of these regulatory bodies, when the majority is the public sector, meaning the government, to establish these regulatories, are you also relying on private sector for the implementation? How does that work on the ground when you have the instability of Venezuela? Which then takes me back to your question, Ramesh, in terms of how are you accounting for this growth when we see a country like Venezuela which then defies this growth, and it's linked not to a lack of need, the need is there, but it's a lack of this political stability. So how are the markets that you're talking about dealing with this or anticipating this? Okay, so we have another.
Sorry, the last one.
Yes.
So my name is Tatiana Adrian, and I'm from Colombia, and I work at the University of Los And I wanted to ask both Veronica and Analia about something that I think relates to both of your talks, and it's not only how strong are regulatory agencies, but how symbolically are they perceived to be strong, right? And so maybe the generic name, like with bioequivalence and everything very strong, is not being adopted because probably consumers are more familiar with brands, they can trust more in brands than they trust on regulatory agencies that have just been created or that have been there forever, like Anvisa, but they still, distrust government more than they distrust private companies. So, to Analia, whether you're working on anything regarding reputation, and to Veronica, whether you think that may play a role in both Mexico and Chile.
Great. And we have a good amount of time for you all to answer.
Should I? Okay. So, although I didn't get the question, I'm going to say that the South Asian harmonization initiatives, which I'm familiar with, I have advanced, but also it's So, but I'm gonna let my colleague answer specifically, but just a color note, the Philippines, not the Philippines, the South Pacific Islands are also moving into an arrangement like the CRS, the Caribbean, because they have the same problem in terms. So there is a lot of cross-pollination between some of these initiatives. A few things, and I think you brought a great point, which is reputation. Reputation is the reason that probably 80% of the market here in the U.S. is generics by volume. It's just people trust, and it's also because all the other aspect that Veronica talked about in terms of a generic policy and in place, especially substitution. In our countries, in Latin America, one is reputation. Also, there is a flagrant campaign by industry to use reputation to actually have the patient distrust. There is a lack of transparency of the industry relationship with physicians, which is actually, I invite you, it was a big part of the resolution to try to look and address that there's like put pressures between the doctors and the industry to have problems having generic substitution or generic policies. Argentina, which was shown by Veronica to have one of the worst generic uptake, had a very comprehensive generic policy for many years. Once enforcement went away, it's now one of the worst countries in terms of generic penetration. In terms of the private versus public sector for regulatory authority, there are very few areas which I think we can be so black and white in saying that regulation of medicines, it's a government business, should be, and it is in every country. That doesn't mean you cannot outsource certain functions like laboratories and all that if they're well regulated. But I think overall, any countries, and the strongest countries, industrial-based countries like Europe, and it still retain that as a government function. And I don't think private will present any other advantage doing political instability, because I would argue that today Venezuela has instability across the board. But and I would argue also that the problem is not regulatory, it's access directly and capacity to pay and to import due to the regulatory. So we encourage each country to make their own decisions in context, but to retain the stewardship and governance over the pharmaceutical sectors when it comes to quality and effectiveness. But we also encourage countries to look at models that will make them more efficient. So, for example, one of the big disputes in Mexico is that Mexico only accepts bioequivalency done in Mexico. And that's considered a barrier to the generic market by design, probably, for imports rather than by, just by mistake. But I think it's an interesting conversation, but mostly entry to the markets and the way the regulatory authorities are positioning in terms of reputation. It's a great determinant of how much generics are used in the market.
Okay, I think there were two questions that were raised. First of all, thanks for very interesting questions. I think I would agree that pharmaceutical regulation is something that squarely rests within the public sector. I think the attempts of countries to rely on sort of self-regulation by the private sector have had sort of decidedly mixed results. I mean, it goes some distance, but not far enough.
Not far enough, yeah.
I think there's no question about that. But in the context of countries like Venezuela, where you're talking about political instability, macroeconomic, issues, and so on, I think in that context, both the public and the private sectors are sort of equally affected by that process. So in some senses, I don't think that there is, from a regulatory perspective, that there is sort of much of a difference in how country markets react to these kinds of, changes in the macroeconomy or the political economy of a country. With regard to this question on what one can learn, I guess every effort, starting with sort of North America and Europe, and then the International Convention on Harmonization of Regulations. I think there is much value to bring together countries within one umbrella for these sorts of things. And increasingly, I think we are observing convergence to how these regulations are actually adopted and implemented. In the Asian context, I mean, there is a lot, obviously, that Latin America can learn through the efforts that have been implemented amongst the ASEAN countries. But I think one dynamic which is particularly interesting is sort of how competition sometimes can come in the way of efforts to sort of harmonize regulations, because the personal interest, one of the questions that I had talked about, I had asked the question about earlier, was how sort of the industrial imperatives of a country sometimes come in the way of what you would expect to be commonsensical policy when you look at it from sort of a more health perspective. And that has sometimes stymied efforts for harmonization of pharmaceutical regulation in the ASEAN region, particularly, I think, with regard to India and China, which often see each other as competitors in various ways. And I think there are some lessons to be learned from that as well. But in general, I think having harmonization or at least a convergence of pharmaceutical regulation across the entire region has significant benefits in terms of the pharmaceutical market, consistency of application of these sorts, these things across regions and all. So I think all in all, it's a good thing.
Thank you for the interesting questions. And I think as we move along in the day, I think they kind of put together some pieces of the puzzle that we saw presented. So let me first answer Ken's question about the physicians and their kind of stronghold and their influence in the policy debate. And you ask what can be done kind of to change that. Would there be a change? Would we anticipate a change very soon of have it mandatory to add the INN name to the brand name? I think physicians traditionally have been very strong in Mexico in terms of the policy making. But I think what is probably very important is going forward in making decisions about that and moving forward perhaps to a mandatory INN prescribing is to think about the coalitions that could be formed. I'm thinking coalitions in terms of stakeholders to then push forward a requirement for INN prescribing. I'm thinking particularly the pharmacies could coalesce with consumers and saying we would like to have substitution, effective substitution in place, and therefore the first step for doing that is INN prescribing. So in forming kind of a coalition, a stronger coalition, they might go forward and saying we will put something forward in the legislation, and then hoping that kind of weighs or that is a sufficient weight to outweigh the physicians with their demand of sticking to just brand name prescribing. It's hard to say how it will play out because you have then the pharmaceutical industry, and I think the pharmaceutical industry falls into two sectors. You have the multinational companies that often vote in favor of brand prescribing, but then you have also a stronger or increasingly stronger domestic pharmaceutical industry in Mexico that is generic, and that could perhaps then add to the weight of pharmacies, chain pharmacies, and patients of saying, no, we would like to have a mandatory INN prescribing. It's hard to see for me or foresee how it will play out. I have seen very surprising kind of outcomes of these policy debates, depending on how strong the coalitions are as a debate goes forward. In all of that, what I think, and that brings me to the second point, which is advocacy, and that answers to some extent the question by Tatiana and the question by Gabriela in terms of how generic medicines are perceived. And I think that could perhaps also be a theme as we go forward in the day, debating the topic of affordable medicines, because the trust of the consumers in this in generic medicines is extremely important. The similares, the pharmacy similares exist and is still existing, has an important market share in Mexico. And is perceived by many as trustable, so that's a trustable brand. They have, from from my knowledge, never been any scandal in terms of their quality, so that there would be a big scandal saying these medicines sold in these pharmacies are a substandard. So in terms of the consumer perception, I think they play a role and they have are trusted, particularly also because they offer what are consultorios, what are physician offices within the pharmacy. So they were the first mover in the market to create an interesting model where you have a physician within the pharmacy and operating within the pharmacy. That model have now expanded to other chains, but because they were the first mover to implement that model, they have that market share, I think, guaranteed. So it's an important one. And in Chile, there's also something like Similares, the brand Similares. So I think from that perspective, I think it's there is certain trust, but the consumers probably do not realize that now these Similares are not Similares in the sense of they do not have bioequivalents, they have bioequivalents. But obviously the brand Similares still exists. No? Dr. Similares still exists. Which brings me, I think, to a third point, which is in response to what Analia was saying with enforcement. I think it's very, very important to not only, as we go forward, have, for instance, mandatory prescribing of INN, but also guarantee the enforcement of it. This is exactly your point, Analia, in terms of Argentina, where there is mandatory, and it has not necessarily been implemented. There is the regulation that says it, but it hasn't been implemented. That also doesn't bring us forward. For instance, let's say we have a successful political change in Mexico. You have the implementation. You need to guarantee implementation, and which is actually aligned with what Analia said right in the start of her presentation, how important is the regulatory authority then to make sure that things are enforced.
Sorry, if I might just add just a footnote to that particular discussion. I think any attempt to sort of foster either generic prescribing or generic substitution, which are slightly different from each other, cannot rely exclusively on mandates. And I think that those countries which have tried to sort of implement a combination of these have tried to sort of integrate that with the process of educating physicians and so on and so forth. And I think what is increasingly clear is that when physicians are able to internalize this concept of value for money and so on, then I think they're a little bit more amenable to persuasion than might be the case if one were relying purely on mandates and implementation of these kinds of policies across the board. And there are countries which have actually had some degree of success in that effort. So.
Good point.
So I'm getting the signal that we are heading to lunch. So thank you. I want to thank all of you for really fascinating presentations. Please join me in